The Department of Communicative Sciences and Deaf Studies prepares students for 4 professions: audiology, deaf education, sign language interpreting, and speech-language pathology. Audiologists are concerned with the prevention of hearing loss and the assessment and treatment of auditory and vestibular function. Educators of the deaf work with people who are deaf or hard of hearing, typically in public schools or residential school settings. Sign language interpreters facilitate communication between people whose primary language is American Sign Language and those who have a different primary language. Speech-language pathologists assess, diagnose, and treat speech, language, voice, and swallowing disorders, working with children and adults in educational and medical or rehabilitative settings.
Kinesiology prepares professionals to enter the field ready to assess many physical and psychological components of physically active individuals, as well as determine appropriate remedies to address their health and wellness needs. Our clientele and patients are often found in need of physical activity or exercise to prevent and/or treat their condition. We work with individuals and groups from school-age student through geriatrics. We also develop professionals who manage the business side of sports and athletics.
We enhanced our students' college experience by providing academic advising, holistic support, and peace of mind as they reach the finish line, graduation.
While nursing forms the backbone of the healthcare profession in the U.S., registered nurses provide critical healthcare to the public wherever it is needed. It is the nurse's humanity that keeps nursing care patient-focused rather than task-focused, gracious rather than defensive, and therapeutic rather than mechanical. In assessing a patient and communicating to a family within a community, nurses do not just consider test results. Through the critical thinking exemplified in the nursing process, a nurse uses their clinical judgment to integrate objective data with the subjective experience of a patient's physical, spiritual, and behavioral needs. This ensures that every individual receives the best possible care, regardless of who they are and where they may be. Nursing responsibilities include performing physical exams and health histories before making critical clinical decisions. They also provide health promotion, counseling, and education to individuals, families, and communities. They also complete and communicate interventions, coordinate care, and they do all this in collaboration with a wide variety of healthcare professionals in varied settings.
To protect the public's health, graduates from this major are prepared for careers with official and voluntary health agencies at the federal, state, or local levels of government, as well as the private sector. Graduates may be responsible for planning, implementing, and evaluating health education programs for human resource management and healthcare organizations, or for assessing the health effects of exposures that occur in the environment, home, or workplace.
The Central California Center for Health and Human Services and its institutes, centers, and programs bring together university expertise and community professionals, agencies, and organizations to improve the health and well-being of communities in the region.
So physical therapy graduates, they're the treatment providers to people with impaired mobility. They are your movement experts, and they're fundamental experts and members of the healthcare team. Our graduates will be patient first, wellness first, movement first, and evidence-based professionals. They're comfortable with and they're able to perform as a hands-on practitioner, a consultant, an educator, administrator, or a clinical scholar. They are equipped with a unique set of critical thinking skills and training that enables them to perform at a high level. Our graduates will be acknowledged by consumers as practitioners of choice and clients will have direct access to physical therapy services for the diagnosis of, interventions for, and prevention of impairments, activity limitations, and environmental barriers related to movement, function, and health.
Recreational professionals provide programs and services in communities to enhance the quality of life. We create opportunities to increase health, wellness, and social opportunities by providing access to facilities and services in the community. Our students will work as program coordinators, supervisors, and staff with public, nonprofit, and private agencies.
Social work graduates seek to serve individuals, families, groups, communities, and organizations from a multi-system perspective. The wide range of agency settings that employ social workers include healthcare, child welfare, behavioral health, social services, criminal justice, and education. Within these settings, some of the varied roles social workers assume are being a direct service provider, an advocate, broker, mediator, community organizer, program developer, and case manager.